So hello everyone, welcome back to Shraddha Academy. So in this video we are going to learn about the x-ray. This is a plain x-ray of the ankle joint. This is the dorsoplantar, because from upside we can see the dorsal part, from below it is the plantar view. So this is known as the dorsoplantar view of the ankle joint, and this is the oblique structure of the ankle joint, where you can see the parts. Okay, so as you can see, these are the phalanges upside. Okay, these are phalanges. Below that you can see the metatarsals. In the hand it was carpals, in the leg it will be tarsals. This is phalanges will be common in both of them. These are metatarsals and these are tarsal bones, in which you can see the calcaneus bone clearly in this oblique view of the plane view x-ray of the ankle joint. This is the, which bone is this? This is a tibial bone, this is fibula bone. Tibia and fibula. Here also the tibia which is there, it is connecting with the thallus bone. Thallus, in which you can see, you could not see here, you can see here the thallus bone. And just in front of this is a navicular bone. Okay, and the cuboid bone is also present here. Just forward the navicular bone is the cuboid bone. After this, here three bones are continuous. Three bones are there. There are lateral cuneiform, intermediate lateral cuneiform, intermediate cuneiform, and this will be the medial cuneiform. This will be the cuboid. Then comes lateral, intermediate, and medial cuneiform. Okay, now this one is correct. This is calcaneus bone, this is thallus bone, which is connected with the tibia. So this was all about this. Which kind of x-ray is this? Starting in the practical examination you should say this is a plain x-ray of anterior posterior type of x-ray. Okay, so as you can see, there is the covering of the anterior part. Okay, so you have to say that it is the anterior posterior type of plain x-ray. So this is the pelvic joint, you should say. You just don't say that this is the hip joint, because whole pelvic bones are present here. Okay, so you have to say that this is the pelvic joint x-ray. Here you can see the pubic symphysis, this is the sacrum bone, this is the coccyx, and this is the ischium on the both side, this is the ilium on the both side. Okay, as you can see, there is a pubic symphysis, and just the round structures which you can see here, it is the obturator foramen. So this is the femur bone which is attached to the pelvic bone. This is only, it is known as the hip joint, where it is attached to the acetabulum. Okay, so here you can also see the vertebral column, in which you can see it has the lumbar. Here both are lumbar vertebrae and remaining a sacrum. Totally there are 5 sacral vertebrae present, which are joined or combined themselves in one part, and this is the coccyx. Okay, so this is the greater toe, this is the, so as you can see, this is the lesser tuberosity. Okay, not tuberosity, it is the greater trochanter over here, and this is the back side. At the posterior side you can see the lesser trochanter. In between the greater and the lesser trochanter you will see the line. That line is known as intertrochanteric line. Okay, so this is the neck of the femur, this is the head of the femur. Most commonly fractured part of the femur is the neck of the femur. Okay, this is a surgical part. And the one thing which you can see, can you see here this part, in which it will be present on the hip bone, and that is over here, this part I am telling about. This is the fovea capitis, which can be asked in the practical examination. So this was all about the hip joint. This is the plain x-ray of the knee joint, which you can see here. First of all, you can see the lateral view of the knee joint, and this is the anterior view of the knee joint. As you can see here, you can see the patella. There is the presence of patella in the lateral view. Okay, so in the anterior view, you cannot see the patella because it is here, located over here. In this video actually it's not looking that clear, but it will be present at the superior side. Okay, so you can see here is the femur, tibia and fibula. So same here also, this is a tibia, this is fibula. So the ligament which is present at the superior side of the patella is patellar ligament. Okay, so this is the plain x-ray of which joint is this? Yes, this is the hand joint. Hand joint, that means the elbow joint present. Okay, so this is the lateral view, this is the anterior view. In this, what is difference in both of them? You can see clear fracture. Okay, if anywhere the fracture is there, then you can see it clearly. In lateral view, we'll see first, this is the humerus, this is the medial side. Okay, medial epicondyle is present here, and this is the ulnar bone is there, and the round head shaped part which you can see, it is the radius bone. Same here also, this is the trochlear, this is the olecranon process which will be present in the posterior surface of the humerus bone. This is the ulnar bone, this is the radius bone which is round in the shape. This is the head and neck, and here comes the 8 carpal bones. Okay, so this carpal bones, you have to, how many which you are seeing capable to see here, you should tell to the examiner. Okay, this is the x-ray of the posterior, this is a plain x-ray of the posterior view, and this is the plain x-ray of the lateral view. As you can see in the posterior view, there is the cervical vertebrae will be present, in which the first two vertebrae, that is atlas and axis. First is atlas vertebra and second one is axis vertebra, which is absent because it is present over here, which you can see here. It is very deep, it is actually, you know, inside the skull, so that's why you cannot see them. Then it continues has the what, thoracic vertebra, and then comes vertebral, and then comes the, what is that, sacral vertebrae. Okay, so the cervical vertebrae, they are totally 7 in numbers, and then it continues as the thoracic vertebrae which is 12 in numbers, and then lumbar vertebrae are in 5 numbers. So now what you all can see is the clavicle is present over here, and this blackish part is the lungs. Okay, from backside you are seeing, and this gray part, as you can see, it is the heart. So in the lateral plane view of this x-ray, which you can see is the, look at here, this is the skull which you can say has the occipital, here also occipital bone you can say, and this is the temporal part. Okay, and then this is the cervicals, here you can see this both vertebrae, this is the axis and this is the sacral vertebra. This is the atlas vertebra and this is the axis vertebra. Okay, atlas is the first one, axis is the second one, and as you can see here, there is a nasalis, this is the air sinus present, frontal air sinus. Okay, and this is the zygomatic air sinus is also present, and as you see here, this is the mandible over here. Okay, so even the mandible is present, this is nasalis, this is temporal region, the small part near the nasalis is the temporal region. So hope you like this video, please like, share and subscribe to this channel.